Hi, I'm Dr. Eric Wagner. Today, we're taking a look at shoulder surgery, when it's time, what to expect, and recovery. Some of the most common shoulder injuries, including problems with the rotator cuff tears, long head biceps tendinitis, and shoulder arthritis. In most of these patients, the pain gradually progresses over time, associated with worsening shoulder function. The location of the pain and activities that are most limited are keys to differentiating between the different shoulder problems. Signs that indicate patients may require surgery include marked limitations in their shoulder function and pain that limit daily activities. In particular, I like to tell patients, once they are no longer able to perform various activities they enjoy doing, or once they start modifying their activities, it's time to consider surgery. For rotator cuff and biceps injuries, in many cases, minimally invasive arthroscopic surgery can be used to fix these problems in an outpatient setting. However, in cases of very significant rotator cuff tears or advanced shoulder arthritis, a shoulder replacement is often the best solution to get patients back to activities they enjoy without pain and close to normal function. These replacements can be done in an outpatient setting similar to the arthroscopic procedures and are associated with a low level of pain and relatively quick recovery. We have researched methods to improve the postoperative recovery process extensively. The shoulder replacement is one of the most successful surgeries I perform. Patients often go home the same day of surgery, require very few narcotic pain medications, and remain in a shoulder immobilizer for about 4 weeks prior to starting physical therapy. I then encourage them to perform at least 3 months of physical therapy to help them first improve their motion and eventually their strength. By 6 to 9 months, I expect patients to have very little pain with close to normal function. For example, in our research, we have shown that patients rate their shoulder an average of 30% prior to surgery, increasing to around 80% or higher after surgery. Both arthroscopic surgeries and shoulder replacements represent some of the most successful surgeries we do in orthopedics. Patients have significant limitations in their daily lives prior to surgery and return back to almost any activity they hope to afterwards, including home improvement, golf, tennis, pickleball, and many other sporting activities. Given how important the shoulder is for many daily activities, patients often report these procedures as having a huge impact on their lifestyles and overall health. At Emory, we lead the world in getting patients back in a relatively pain-free recovery protocol for both primary and complex shoulder surgery, which is a large reason why we have patients travel from all over the world to receive treatments with us. The Orthopedic and Spine Hospital is one of the few dedicated hospitals to only orthopedics, consistently rated as one of the premier hospitals in the country. This is one of the most safe and efficient places in the world to have a shoulder replacement, with world-leading low rates of complications like infections and high rates of same-day discharge. The Musculoskeletal Center represents a state-of-the-art clinic and ambulatory surgery center, creating one of the leading centers in the country dedicated to high-level orthopedic care, as well as surgical safety and efficiency. Both of these centers help to make Emory one of the world's premier institutions for primary and complex shoulder surgery. If you need expert surgical advice, have been told you need surgery elsewhere but want a second opinion, or if you have not recovered like you expect from a surgery performed elsewhere, come see us for a surgical opinion. We do both in-person and telemedicine consultations. The team of people that work at Emory Orthopaedics and Spine Center and the Emory Musculoskeletal Center are what make both places truly great. Each person specializes in a specific job and contributes effectively to the ideal team to create the perfect environment to deliver highly specialized care in shoulder surgery. We welcome you to schedule an appointment at the Emory Orthopaedics and Spine Center so we may provide you with an individualized plan to care for your needs, whether this is the first time you're being treated for your shoulder problems or if your recovery has not gotten you back to the level of function you're hoping for. We look forward to caring for you at the Emory Orthopaedics and Spine Center